What if I told you that one of the clearest warning signs of a future heart attack is sitting right at the end of your fingertips, quietly visible every single day? And almost nobody over the age of 60 has ever been taught how to recognize it. Most people think their fingernails are just cosmetic, something to trim, polish, ignore, or complain about when they become brittle with age. But your nails are not dead decoration. They are living biological tissue connected directly to some of the smallest blood vessels in your body. And those tiny vessels often reveal circulation problems years before a major cardiovascular event ever happens. That means your nails may begin showing evidence of declining blood flow, heart strain, oxygen problems, or arterial damage long before chest pain ever appears. The frightening part? Most people miss the signs completely because nobody ever taught them what they were looking at. I am Dr. Ben Walker, and today I'm going to show you 4 nail signs that cardiologists and vascular specialists quietly pay attention to. Signs linked in medical literature to circulation problems, stroke risk, peripheral artery disease, and even early heart failure. And the 4th sign is the one that matters most because you can test it yourself in less than 5 seconds with nothing more than your own hand. But before we begin, I want you to do something for me. Look down at your hands right now, not later, not tomorrow morning, right now. And I want you to ask yourself honestly, have your nails changed over the past few years? Do they look paler, more bluish, more brittle? Do your hands feel colder than they used to? Leave your age in the comments below and tell me whether anyone in your family has ever had a stroke, a heart attack, or circulation problems, because your family history matters more than most people realize. And if you find this kind of practical, evidence-based health information helpful, take 1 second to subscribe and like the video. It genuinely helps this information reach more adults who may need to hear it before something serious happens. Now, before I show you the 4 warning signs themselves, you need to understand why your nails are capable of revealing heart problems in the first place. Underneath every fingernail is a dense network of microscopic blood vessels called capillaries. These capillaries are extraordinarily sensitive to circulation changes. In fact, they are often the very first blood vessels in the entire body to show evidence of reduced blood flow because they are so small and so delicate. Think of them like the smallest streets in a city. When traffic problems begin, the tiny side roads jam, first long before the highways completely shut down. That is exactly what happens in the aging cardiovascular system. After the age of 60, blood vessels gradually become less flexible. Arteries stiffen. Plaque slowly narrows. Circulation pathways. The heart must work harder to push oxygen-rich blood to the furthest parts of the body, and your fingertips happen to be among the furthest destinations. That is why nail changes can become such an important early warning system. Not because nails themselves are dangerous, but because they quietly reflect what is happening deeper inside the circulatory system. The first sign I want you to look for is something called nail bed discoloration. And there are 2 specific colors that matter: bluish nails and unusually pale nails. Let's start with bluish discoloration. If the base of your nails begins looking slightly purple, blue, or grayish, especially in natural daylight, that may mean the blood reaching your fingertips is not carrying oxygen efficiently. This condition is known medically as cyanosis. Now, there are 2 different forms of cyanosis, and understanding the difference is extremely important. The first is peripheral cyanosis. This usually develops gradually over time and tends to affect the fingers and toes first. The lips and tongue remain normal in color. Peripheral cyanosis is commonly linked to poor circulation, narrowed arteries, or early cardiovascular dysfunction. The second type is central cyanosis, and this is much more serious. This is when the bluish tint also appears on the lips, tongue, or inside the mouth. That can indicate a major oxygenation problem involving the heart or lungs and requires immediate medical attention. Here's what many people over 60 never realize. Early heart failure often develops silently. No dramatic chest pain, no collapse, no obvious emergency, just slower circulation, lower oxygen delivery, more fatigue, and subtle visible changes in places like the nails. I remember a patient named Harold from Phoenix, Arizona. Harold was 73 years old and had noticed for nearly a year that his nails looked slightly darker and more purplish in the mornings. He ignored it. He assumed it was simply aging. Then one afternoon, his granddaughter asked him why his fingertips looked blue. That comment finally pushed him to bring it up during a routine checkup. His doctor ordered an echocardiogram and discovered early congestive heart failure that had not yet caused major symptoms. Because it was caught early, treatment began before hospitalization became necessary. That single observation likely changed the course of his next several years. Now, pale nails can also matter. Extremely pale nail beds may signal anemia, poor circulation, or reduced blood flow efficiency, and chronic anemia forces the heart to work harder because the blood carries less oxygen. Over time, that increased workload can put serious strain on the cardiovascular system. So here's the practical step I want you to take tonight. Go to a window during daylight hours. Hold your hands flat. Look carefully at the base of your nail beds. Do they appear healthy pink? Or do they look bluish, grayish, or unusually pale? And most importantly, does the color improve when your hands warm up? If the discoloration remains persistent, especially together with fatigue, shortness of breath, dizziness, or cold hands, that deserves a conversation with your doctor. And if you ever notice bluish lips or tongue along with bluish nails, do not wait for a future appointment. That is an emergency. Now, the second nail sign is one that millions of older adults dismiss every single day without realizing it may be connected to arterial disease. Brittle, slow-growing nails. I know what many people think when they hear that. Of course my nails are brittle. I'm getting older. But age alone is not always the full story. Healthy nail growth requires constant delivery of oxygen, nutrients, minerals, and blood flow to the nail matrix. When circulation declines, nail growth often slows dramatically. The nails begin splitting, peeling, breaking vertically, growing unevenly, and in many older adults, one of the most overlooked causes is peripheral artery disease. Peripheral artery disease, or PAD, is what happens when plaque narrows the arteries supplying blood to the limbs. And here's the important connection most people never hear explained properly. The same plaque that causes heart attacks in the coronary arteries, and the same plaque that causes strokes in the arteries leading to the brain, is the same plaque that can reduce circulation to your hands and feet, which means brittle nails are sometimes part of a much larger cardiovascular story. But here's where it becomes especially important. PAD is often silent in the early stages. Many people don't experience dramatic symptoms at first. Instead, the body gives smaller clues: cold feet, cold hands, leg fatigue when walking, calf heaviness going upstairs, slow wound healing, and brittle nails that no longer grow the way they used to. There was a woman named Eleanor from Vermont who spent years assuming her nails were splitting because of dry weather and gardening. But what finally caught her attention was the heaviness she felt in her calves every time she walked uphill. Her doctor eventually performed a simple ABI test, an ankle brachial index, which compares blood pressure in the arm and the ankle. The result showed moderate peripheral artery disease, and because it was caught early, she was able to dramatically reduce her future stroke and heart attack risk through treatment, walking therapy, and lifestyle changes. The nails had been signaling the problem for nearly 2 years. Most people just didn't know how to read the signal. In part 2, I'm going to show you the simple 5-second circulation test you can do on your own fingernails right now, and the hidden half-moon sign at the base of your nails that most adults have never even heard of, despite its strong connection to circulation and heart health.